Hi, I'm Tim. I'm an EMT here. I remember Joe's case. Kelly and I drove up with lights and sirens about 9 a.m. to a 16-year-old who gotten his arm stuck in a hay baler. We saw Joe, his mom and dad sitting on the porch steps when we drove up. Kelly, the paramedic working with me, assigned clear roles before we got started. I would assess his vitals and medical condition. Kelly would inspect his injuries. This way we could kind of work efficiently and effectively as a team. Our role in emergency medical services is to respond to emergency calls, provide medical care, and transport patients to higher needs medical facilities. We immediately got to work. I established Joe's airway was patent. He was breathing rapid, deep breaths, but circulation was intact, and he was alert and oriented. In obvious pain, though. All the while, Kelly was inspecting his injuries. He saw that it was significant deformity to his right distal forearm and hands. Really, his right index finger was pretty damaged as well. We worked quickly to manually stabilize Joe's arm, irrigate those lesions, apply sterile dressings, and splinted his arm and hand for the travel. As we were starting to load into the ambulance, I could tell Joe's dad was really distraught. He was saying, "I can't believe this. It's all my fault. He's never going to forgive me." And so understanding it was kind of a traumatic and frightening experience for all the parties involved, I tried to reassure Joe's dad that it was really no one's fault. We knew it was an accident, and we'd do everything possible to make sure he gets the care he needs. On the ride to the hospital, I performed a secondary assessment to monitor for changes, identify any injuries that may have been overlooked. And I'm glad I did. Joe mentioned that he had rolled his ankle immediately prior to falling in the hay baler. Once we arrived at the hospital, Kelly encouraged me to give a patient handoff to the nurse using the S-bar mnemonic. I provided a situation, background, assessment, and our recommendations at bedside. Finally, Kelly and I went back to the ambulance and disinfected everything from the call, also to make sure the environment was safe for the next patient.
Hi, my name is Nurse Abby, and I'm a registered nurse here on staff at the emergency room. One of my main responsibilities working in the emergency department is I will receive the patients that are in incoming traumas from the EMTs. So I give them the original course of action care. So that'll include just their original set of vitals, pain and discomfort level, and just the general information that'll go into the doctor's notes. So while I'm doing that, a CNA is working on getting him admitted and getting his medical history and making sure that it's up to date so we can give him the correct course of treatment based on his medical history. And we do have a physician who works in the ER, and he will give the official diagnosis and then order the medications and x-rays as needed, and I will administer those. And once he is admitted, he was prepped by me to be moved to the Trauma and Recovery Center.
Hi, I'm Peter. Thank you for including spiritual health in the healthcare meeting. Joe is very active in his church and his youth group, and spiritual health is going to be very important for his recovery. His pastor and his church have already expressed a desire to assist Joe and his family during his recovery. Remember, it is important not to push Joe to express his feelings. He should be allowed to grieve on his own time. Do any of you have any questions? I will be here for any of your spiritual needs while you are in the hospital. Mr. and Mr. Smith, may I speak to you in the hallway? Mr. and Mrs. Smith, I just want you all to know that I'm here for your spiritual health needs as well.
Peter, I'm feeling a lot of guilt about what happened. I ruined my son's life. How could I ever forgive myself?
Mr. Smith, I just want to reiterate, this is not your fault. This was an accident, and accidents happen. You know, with your permission, I would like to reach out to your pastor. He may be able to give you additional spiritual and emotional support. Would that be okay?
Yes, I would like that.
Hi, Joe. My name is Kelsey, and I'm a physician assistant working with Dr. Chin. Joe, we're going to be performing a surgical debridement and irrigation of your arm. This means that we're going to remove any infected tissue and wash out that arm as well to decrease the risk for infection. We're going to do this in the operating room under general anesthesia, so you're not going to feel anything. Also, while we're in there, we're going to revise that traumatic amputation and fix the fractures and with some hardware. This procedure will be your best chance at regaining good function of that right arm. There are some risks with surgery that include infection, bleeding, and adverse reactions to anesthesia. Your injury does have a high risk for infection, which is why we're washing you out in the OR, why we've given you antibiotics before surgery, and we're going to keep you in the hospital for a couple of days and give you IV antibiotics as well. We don't anticipate significant blood loss, but we're going to have you sign the consent for a blood transfusion just in case. And lastly, Joe, I saw that you had your appendix taken out several years ago. Do you remember if you had any reactions to anesthesia then?
No, he did just fine.
Great, Joe. I'm going to do a history and physical exam, and then I'm going to have you sign some consent forms, and then they'll wheel you up to the OR shortly. Do you all have any questions? Hello, Mr. and Mr. Smith. Joe did great. Everything went according to plan. He's in recovery now, and they should bring him back to his room in a couple hours. We still plan on keeping him for a few days for IV antibiotics. We'll also give him an updated tetanus shot. Our social worker is going to work with you all in trying to get him a primary care physician as well as some other things. I want him to see that primary care physician in 2 weeks to get those sutures removed. And then in 4 weeks, I want him to come up to our office and see Dr. Chen and myself, and we're going to remove those pins in his arm. At that time, we also can start occupational therapy. And then in 8 weeks, I want you to come back to the office so we can remove the splint. Do you all have any questions?
I'm worried about getting transportation to St. Louis. Do we have to see you that many times?
Yeah, great question. I'm definitely going to need to see you all at the 4-week appointment to remove those pins. But how about we do a telehealth appointment for the 8-week appointment, and we'll coordinate it with your primary care physician so that they can help with the splint removal, and we all can make sure that it's going according to plan. Any other questions? Okay. I will explain all this again to Joe when he gets up here, okay?
Hey there, my name is Cecilia. I'm a case manager, and I was the one who was assigned to work with Joe and his parents in order to plan their discharge and follow-up care. So a case manager is a social worker who specializes in coordinating care for those who require long-term or individualized treatment. As a case manager, I don't administer care directly. Instead, I work to ensure that all of those who are administering Joe's care have the same knowledge of his case and that they are able to give the best care possible. So in talking with Joe's parents, they did have individual concerns that we met during their interview. So Joe's mother was concerned with how they were going to pay for all of the medical bills that Joe would have, as they didn't have any health insurance. So to address this need, we discussed breaking up the medical bills into smaller increments to pay off with credit cards. And then we sat down and filled out some federal aid applications that would cover the rest of the monetary needs. And Joe's father, he had some emotional needs as he expressed guilt in feeling that he was responsible for Joe's accident. And Joe also had some emotional needs too, as he wasn't sure how he was going to adapt in the wake of his accident. So I encouraged both of them to pursue their emotional and spiritual needs as well as their physical through attending counseling and therapy that was federally funded with their newly established providers. It is easy for those who experience these traumatic events to throw their abstract needs to the side, and it is understandable to do so in life-threatening circumstances, but it is important for me as the case manager to direct Joe and his family to prioritize their mental health in tandem with their physical needs. So I really highlighted that when we met. As the switchboard of the caring process, it is my responsibility to ensure that Joe and his family are having all of their needs met and they're being put into contact with professionals who can help them. I'm responsible for checking in on Joe and his family to ensure that they are getting the best care possible and meeting up with the clinical team to ensure that they are understanding what Joe needs. So in doing these things, I am constantly evaluating and improving practice and ensuring that the best care possible is being provided to my patients.
Oh, hey, I'm Greg. I'm the youth pastor here at Fellowship Baptist Church. Kids call me G-Dog. The youth group's comprised of Joe's peers and mentors, and really integral to supporting his spiritual health during his recovery. While not really directly involved in his medical care, they can provide an impactful encouragement and meaningful faith aspects that he may have only been addressed with the hospital chaplain otherwise. During his hospital stay, I got the opportunity to visit him and shared with him an opportunity to tune into our services from his phone. He was really happy to hear that.
Hi, I'm CNA Kathy, and I work in the Trauma and Recovery Center. So one of my main jobs is I prepare discharge letters and prepare patients to be discharged. So in Joe's case, in his discharge letter specifically, it was given instructions for his post-op care at home, how to administer his course of antibiotics after he leaves the hospital, and just his general follow-up appointments. So it explained who he needs to go for PT and how often, and when he should follow up with his general physician. So I just sat him and his parents down and we went through it together and explained what needed to happen and how they should do that. And if they had any questions, who should they call? And then he was ready to go.
Hi, I'm Joe's occupational therapist. My role is to help Joe relearn how to perform everyday skills. His injury was quite severe and resulted in the loss of a finger and range of motion in his right hand and arm. So Joe and I will be working together twice a week for at least 8 weeks to work on the range of motion in his right hand and wrist. I anticipate that he'll have significant swelling in the hand and arm, so we'll work with him to manage that as well. Once he finishes the initial therapy, we'll begin a strengthening program that he will mostly work on at home by himself. I did sit down with Joe and his family to discuss the support that Joe's going to need at home and educate his parents on his home exercise program. We discussed Joe's limitations while he's healing and what kinds of warning signs to look out for that may indicate complications in Joe's healing. They were very engaged in the meeting and seemed prepared to provide Joe with all the support he needs. Joe's been very stressed about his return to school and how his injury will impact his grades and his participation in band. Joe plays the saxophone. So I reached out to the school counselor to relay these concerns and to give suggestions on how the school can assist Joe. The counselor has assured me that Joe will have a student with him to scribe for him until he's able to write on his own. And I plan to provide Joe with some extra exercises to help with the dexterity in his right hand in hopes that he'll be able to return to the band as soon as possible. He's expressed to me how losing a finger impacts his ability to play, and I encouraged him that with extra practice, he will learn to adapt his playing just as he will learn to adapt how he uses his hand in all other situations. Hello, my name is Mr. Schneebly, and I am Joe Smith's school guidance counselor. My role is to be Joe's advocate at the school and the link between Joe and all the faculty here. I have already informed Joe's teachers of his accident and subsequent injuries, and I've worked with all of his teachers to arrange for other students to help Joe by scribing for him in his classes, assuring, of course, that Joe does the work on his own. Doctors have also provided Joe with a note to excuse him from his 6-week gym class, and I've passed that information along to Joe's gym teacher. I know that participating in band is very important to Joe, and I've spoken with Mr. Singer, his band teacher, who assured me that Joe will be an active participant in the band, and Mr. Singer is willing to work with Joe as needed to help him ease back into playing the saxophone when he is ready. I'll be checking in with Joe periodically to see how things are going as he adjusts to his new normal, and we will be keeping a close eye on his grades during this difficult time. Hi there, my name is Mr. Singer, and I am Joe Smith's band teacher. Mr. Schneebly reached out to me to inform me of Joe's unfortunate accident. Joe is a valuable member of our school band and loves playing the saxophone, so I know that not being able to play will weigh heavily on Joe. I intend to do the best I can to keep Joe engaged and active in the band until he's ready to play again. Mr. Schneebly and I will both be looking out for Joe during this difficult time in case he is in need of any extra support. And once Joe's feeling up to it, I'm more than willing to spend extra time with Joe after school, working on relearning to play the saxophone after losing his finger. I'm confident that Joe will make a full return to the band in no time.